Hello, everybody, and welcome to the May Lymphedema Patient Roundtable hosted by LymphaPress. If you don't know me, my name is Alexa Urcolano. I am the Marketing and Communications Associate here at LymphaPress and a primary lymphedema patient myself. And I am joined by our lovely panel of ladies. We have Angela Jones, our lipolymphedema patient and health coach. We've got Catherine Rosenberg, pediatric cancer survivor, secondary lymphedema patient advocate, and as I always say, math teacher, although we're nearing the end of the school year, so
20 days left.
20 days left. So no math questions after this month. And then, of course, we have Karen Ashforth, who is a certified lymphedema therapist and fibrosis queen. And we are so lucky to have her with us tonight as well. So I'm going to go over some quick little housekeeping real quick before we jump right in. We have our Q&A box. We invite you to please pop any questions you have throughout the evening into the Q&A box. It should be at the bottom of your screen, and we'll get to those about halfway through the evening. We also have some questions from last month that we'll get to as well. And the gentle reminder, of course, that we are not your personal care team. We're not your doctor, so we can't advise you specifically on your treatment, although we can speak from our own experiences and happy to do so. And it is Mental Health Awareness Month this month. So I was hoping that we could spend some time getting vulnerable and talking a little bit about how our mental health and our physical health, specifically our lymphedema, there's a lot of overlap there. And there's a lot of effects that come from the lymphedema on our mental health and vice versa. So I'd like to open up to the panel here, and I'm happy to speak from my own storied experiences as well, dealing with mental health struggles and lymphedema. But I'm hoping to share some strategies that we all have used for coping with these issues as well. So that was kind of a rapid fire intro. We're going to jump on in. Does anyone on the panel here want to get us going in talking about mental health? Or I could start.
Well, I will say that as a clinician, that people's emotional state is so tied into the physical state, and that it's so critical for people to be able to get help if they need it, if they're feeling anxious or depressed or angry or any of those uncomfortable emotions. If that's ongoing, then that's really, really important to address. Obviously from an emotional level, but also from a physical level, because all of those hormones that can get created from being in a state of emotional imbalance really do affect the body. So that's something that I really encourage my patients. If I see someone who's someone with PTSD, and pretty much all of my cancer patients fall into that category. So, finding help to be able to get that balance is critical for the physical success as well.
It's really validating to hear that importance put on emotional and mental well-being too, Karen. I appreciate that, because that is such a facet of our care that often is hard for people to talk about, especially with lymphedema. There's a lot of shame and isolation that can come along with living with this condition. I went through a very self-destructive spiral for many years, and the catalyst of that was my lymphedema, and in denial of having to take on the burden of taking care of it and taking care of myself. So I think we've all have our own stories that we could share that involve that. Catherine, I see you leaning forward as if you're going to say something, perhaps.
Maybe.
Yeah.
So each one of us has a different journey with our lymphedema, and it really is our personal journey. And, just because I do something doesn't mean that it's right for you. And you have to kind of take it with, what you feel is best for you, along with your medical professionals, to really decide, help to make determinations for your treatment, not relying on, oh, this worked for Catherine, or oh, this worked for Alexa or Angela, but it's not working for me, and get kind of bring you down a bit on it, because just because it works for some of us doesn't mean it's going to work for all of us. So it's kind of, I love to use this phrase, lymphedema is a trial and error disease or condition. Okay. So there's a lot of trial and error. And sometimes that trial and error takes a long time to figure out. It took me a long time to figure out what works and what doesn't work.
That's a fantastic point. I mean, I know we talk about that almost every month, how not to compare to one another, but it's so true because it's so easy to fall into more of that muck and mire of blaming yourself. If you look at like, oh, so and so, their swelling is so much smaller, so much less than mine, or oh, they have garments that I don't have, or this or that, and it's easy to blame yourself. And we all have lymphedema, but and that shared experience of living with lymphedema, but the experiences are all very unique within that. So it's important to remember that. Angela, do you have anything to share?
I think it's very important to acknowledge when you are going on a downward spiral, because I find recently with me, I'm also having a knee issue that's tied to my lymphedema and lipedema, and I'm having a knee disorder and a knee problem. And so I find it very important to acknowledge the reality of the situation. Recently I've been telling myself, oh, you're just doing fine, you're doing fine, and was not acknowledging what I actually saw because I didn't want to acknowledge that. So it's so difficult sometimes to admit that there's a problem on top of a problem, and then it's difficult to ask for help with either problem. So I'm just having to talk to myself, some better conversations with myself as to how I'm responding to my lipedema and lymphedema.
Yeah.
Just when I think I have it down, I don't. So.
Exactly. Yeah. And I was going to say that so much of the experience of being someone living with these conditions or these diseases is that the treatment really lies on us to do it. No one's going to come and put our garment on for us or make sure that we're using our pump or this or that. I mean, we may have people in our lives who help us and remind us along the way, but ultimately it's up to us to take care of it. And that is a huge burden to carry. And it's easy to feel resentful of the condition or of the swelling or whatever it may be. Someone in the chats shared, I just want to get to the point where I don't think about it every day. I'm trying to give myself grace and give me the first year as my transition period, which is a really beautiful way to frame it too. It is a transition to adapting to this new life where you don't want to be giving it this negative, attention or weight every single day, but you do have to think about it every day. It's like brushing your teeth. You got to get up, put on your garment, Catherine, I see you raising your hand.
So I'm going to go with my favorite saying. And I know you guys on the panel know what I'm going to go with. So yes, sometimes we all have our little pity parties, but we just have to, move on from that, allow us to have that every now and then, but don't let it control your life. Like, go out and have fun and don't prevent yourself from doing the things you want to do just because you have a lymphatic issue.
Mm-hmm.
Yeah, it's like Angela was talking about last month about getting into activities and things that bring you joy that aren't necessarily about living with lymphedema. It's things with people that aren't lymphedema people. I mean, we have a wonderful, beautiful community, and I love when we get to spend time together, but it is important to have, some attention given to those other parts of you. We're multifaceted people, with a lot to us, more than just our swelling. So it's important to give that some light as well. We've got some great people chiming in the chat too. We've got, of course, our pal Fenton, who says, good evening, my lymphedema friends, LymphoPress panel, support and family, and happy Mother's Day belated to all the moms here within. And we have Melissa saying, good evening all, and Alana saying, good evening, everyone. First time here and already loving it. We're so glad. We love when we have first timers join us. Yolanda shared a really great quote that she tells herself, which is, I have lymphedema. Lymphedema doesn't have me, which is a beautiful way to frame it and a great mantra that I think we all could use most days. I know I can use it some days, especially when I work for a company that deals with lymphedema and you live with lymphedema and it's like nonstop. It's good to kind of step out of that sometimes. So what are some ways that we kind of deal with sort of the mental health stuff that comes up with it. Because I know for me, a thing that has helped is reframing my treatment as something positive, so I don't dread it. So like using my lymphopress pump, I think of it as me time, and I watch a movie or catch up on, you know, a phone call with a friend or read a book or make it a positive experience. But what are some things you all do to cope with the mental health struggles that can come with this sometimes?
That's a hard question.
I know. Well, it's a hard thing to live with sometimes.
That is true.
Yeah.
I mean, for me, I just try to look for the positives. I know sometimes we don't always see those positives, but if you're in active lymphedema therapy and you're getting measured and you see, oh, look, my leg went down, you know, even if it's 0.2 centimeters, it's still a reduction. And you have to look at the little wins. Just because it's not a big win doesn't mean it's not helping, and things, little wins add up to big wins.
Yeah, those little ones, even if it's like for us lower extremity lymphedema people, you know, finding a pair of shoes that fits. I saw we had a question in the Q&A box too about someone who's looking for shoe recommendations. But yeah, even something like that where it's like a little thing, it's so big for people like us who struggle with finding a comfortable shoe that doesn't look like, you know, an orthotic or something my grandmother wore, you know, or something. So it's nice to find those things to celebrate, and people who can celebrate that with you, whether it's your friends in the community or a family member who knows and sees firsthand the struggle that you're going through. I love celebrating the little wins. Sandy said, my husband and I have turned compression pump time into game time. We do crossword puzzles together. We try to complete the puzzle before compression time runs out. I love that idea so much. Oh my gosh, that's so cute. Oh, and Francie says, as the lead of a lymphedema support group, I am seeing increased frustration over not being able to get the treatments they need, find therapists, find doctors that are knowledgeable about lymphedema. Yes, Francie. I mean, that frustration I feel like is ever present, which is really unfortunate. But we had last month Veronica Sinirez, Lymphy Strong, who also is patient services director at Learn, and she shared the Lymphatic Education Research Network's new resource center, which is a really great resource. I'll drop that in the chat, and that might be something to share with your group. It has a lot of helpful directories and things like that. And Kim says she has her grandchildren help her with her pump like she is a superhero. That's really sweet. Angela or Karen, do you have any fun or helpful coping strategies with lymphedema?
For me, it's to get completely away from the lymphedema. And by that, I mean, right now I'm in Arizona, and there are lots of things in Arizona to do, as hot as it is. And I had to search around, but I found a couple of things to get involved to, like readers theater and acting, that kind of thing. And sometimes do something that you've never done before, just for the fun of it. Just something totally removed from who you are, that's legal, and just have a good time learning new things to do, new people. I've met a lot of people through readers theater, and it's really helped me a lot. Not all of them are aware that I have lymphedema, but the ones I'm really close to do know, and they're very supportive. So I think it's good to sometimes just get out of your norm, just get away from what you're used to, go out and find something new. Check out anything that's offered in your community, through the library, through community centers, etc., and get involved in something new. Learn how to do something you may not have been interested in, and you find out, okay, this is something that can take up my time, to take my time off the thing I'm so worried about, which is the lymphedema.
I love that. It's wonderful. What about you, Karen?
So I think that my strategy is trying to find kindness towards self, but also just little tiny acts of kindness towards other people, you know, our friends, family, even strangers, even smiling at someone. I was at the DMV today and I dropped something on the floor and a gentleman picked it up for me. And it was just, you know, melted my heart, his kindness. And it works both ways. And I just find that for myself, when I'm kind of in a funk about something, really focusing on that kindness wavelength is a good tonic for me.
Like the idea of it as a good tonic. I think that's really sweet. And it is true. It makes you feel good when you do something even so small as smiling at someone. I love that. We're getting lots of lovely chatter in the chat as usual too about some other things people do to reframe their treatment time. Just scrolling through it, my goodness. Veronica says that she uses her treatment time as me time. She puts her head back and falls asleep. It's something that has to be done and you just do it. No problem, she says, which I like that perspective of it. You just ain't nothing to it but to do it. And that's the way it goes sometimes. And we also had someone say, Sandy again, whatever we have learned about lymphedema means that we can teach someone about it, including our health partners, which is very true. And a lot of us do end up doing that as well. Melissa says that she and her son are reading through the Bible in a year, and that's what they do while she pumps, which is lovely. More book clubs, and the ukulele from R. Staggy says that they're doing, which you brought that up last month, and I'd love to hear how that's going. And then, yeah, Christine is looking for ways to find an in-person support group because she's having trouble finding one. The Lymphatic Education and Research Network has some state chapters. I can drop that in the chat. But does anyone else have any tips for finding that in-person support? Because sometimes nothing quite beats that, as much as we love our online Zoom community. Maybe local clinics sometimes might have one, although those often, I feel like, tend to be more secondary lymphedema related, you might find.
I think that, COVID isn't as it's still around, but it's not as big of a threat as it's been. And so we're starting to see more and more in-person events. And so, yeah, I love the idea of checking with the lymphedema community and maybe even starting one, because there are great needs for support groups. And maybe even teaming up with someone else, whether it's another patient or a lymphedema therapist. And then there's all kinds of other groups, that can give support through churches, community groups. I think that even joining, I was reading in the chat, someone even said a book club. There's all sorts of ways of having human contact where people can gather and can give each other support around an activity.
Catherine, it looked like you were going to say something.
Mm-mm.
No? Oh, okay.
No.
Well, some people are saying in the chat too to post an event at your local library or look on Facebook. There's a ton of lymphedema Facebook groups. Lymphy Strong is one of them. There's a lot on there, and if you maybe post in there, you might be able to find some local people as well who might be willing to meet, grab a coffee and chat. Okay, well, we might get into some of the Q&A that we're getting, but before we dive into the Q&A that's in the box, I wanted to bring up some that we got over email and from last month that we didn't get a chance to get to. But we had a friend reach out over email, and she wrote, I have lymphedema all over my body and swollen beyond measure. I've had huge lymph bump on the back of my thigh and impossible to reach because of the swelling. I had a home nurse come by and patch it. Now I have a bump of some kind on the left side on the panty line and it keeps bleeding. I managed to somehow use the wand that you use with toilet paper and try to put Neosporin on it, but it's not working well. I have no doctors near me, but I called 911 non-emergency twice last week and I can't keep doing that. How do you care for an unreachable bleeding bump? How do we care for an unreachable bleeding bump? Panel.
It's definitely a medical issue. So you need to get that nurse back out somehow, or you need to find a way to get to a doctor. But if you want to put Neosporin on it, there's a number of ways. And I don't know if it's inside of a crease or a fold. If it is, you can use a towel and just kind of floss it gently. Or you can put the Neosporin on the towel and set it on the bed and just sort of move over towards it. But I think that if it's a place that you can't reach and it's difficult, and it should probably have some kind of a dressing on top of it so that you're not re-irritating it over and over again. I think it's important to get medical care, get a nurse out, see if you can get visiting nurses started up for you. And because this is considered a wound, and visiting nurses will do wound care, and most insurances do cover that. So that's my piece of advice.
Thank you, Karen. Appreciate that. We also got a question last month that we didn't get a chance to get to. And they asked, are massage therapy guns good to use for lymphedema? That's an intriguing question. Go ahead, Catherine.
So I will say that they are helpful, at least for me. I have one and I utilize it to try to help with some of my harder areas to get to in terms of, even if it's just like that it's more fibrotic there, it will help to break it down. But again, like I said earlier, just because it works for me doesn't mean it works for you. So you're going to have to trial it out to see, does it work or not?
And I love what you said, Catherine, about using it on your fibrotic areas, because I think that's where a massage gun can be very, very helpful for many people, but not all, because it can be quite aggressive. And if you have fragile tissues, it's probably not right for you. You might do better with a vibrator. Some people use a towel to pad the tissues so that you don't have quite as much impact from a massage gun. And it wouldn't be my first treatment of choice for lymphedema. Fibrosis, yeah. But for lymphedema, there's lots of other things I think that can be just as helpful and maybe more helpful in terms of moving fluid. I mean, pumps, vibration plates, exercise, wearing compression. I mean, all of those things are great.
Thank you so much. And I see we've got a special guest just popped on, Nazreen Starner, another certified lymphedema therapist. We're so happy to see you here tonight, Nazreen.
Hi, I'm always kid activity, so sorry. I always am running late or not able to come, but happy to see everyone.
Oh, thank you for joining us. We're just going over some Q&A. We did get another question last month too that we didn't get a chance to get to. And this person said that they recently had bilateral kidney stents placed, and they're also currently undergoing chemo treatment for recurrent stage 4 vulvar cancer. Is it okay to use the LymphaPress pantsuit? So is that something, when you're in active chemotherapy, using compression therapy in general, be it a pneumatic compression pump or your compression garments, what's kind of the protocol there? Does that vary?
I think it's a very individual thing. And if in doubt, I would check with your doctor, because pneumatic compression is prescribed by physicians. And so if you have one already and then you go into chemotherapy, you should let your oncologist know that you have it. And I have a lot of patients in chemotherapy that like using pneumatic compression, because sometimes they'll get a little extra swelling after chemo. And sometimes some of the chemo drugs, particularly the taxane-based drugs like Taxol, Taxotere, they can actually cause swelling as a side effect. So I think that it can be really, really helpful. You may want to check with the doctor that did the stents to make sure that there isn't any waiting period for healing before using the LymphaPress. But otherwise, I say go for it.
I again agree with Karen. I have many patients who've used the pumps with chemotherapy without any issue. A lot of times with surgery, though, we do like to refer to the surgeon. So whether it's the nephrologist, or if you did also have some oncological procedure for the cancer too, to kind of check and make sure that they're okay to start with it. But as far as the chemotherapy, again, it does help with a lot of that systemic swelling that can occur with that intervention.
Awesome. Thank you both so much. We've got an interesting question from Sandy, who said, I had an issue with my compression garments when I traveled from 6,000 feet above sea level to sea level. My compression would not stay up at sea level. Is there that much change in our bodies when we go lower? Take it away, panel.
Absolutely. So when we're at altitude, air is thin, whether we're on top of a mountain or whether we're in an airplane. We just don't have the same amount of atmospheric pressure that we do when we're at sea level. So there is a huge difference in how much compression we need depending on what altitude we're at. And that's why we make such a big deal, and why we had so much information about compression when we talked about traveling with lymphedema at our webinar a couple of months ago. So yes, it's a real thing what you're experiencing, and you need different levels of compression at different altitudes.
I always like to say, imagine it that gravity is not sucking you in and supporting you when you're at those higher things. So that compression is going to help, give you that kind of second skin and help get you a little bit more compressed.
That's a good analogy, a good way to think about it. And good to know too, because I'm going in July to Colorado for Camp Watch Me with the lymphedema kids, and that altitude, man, that'll get you. So
Alexa, I can tell you, I've been to Colorado, and that's where I learned about the fact that the different altitudes really play a part.
Yeah. Oh, Sandy says she is in Colorado. Well, that makes sense. Oh, and she's asked also a follow-up question. How do I know what size to get for lower altitude? So I guess maybe I would think you could do maybe more, well, I'll let one of the therapists do it.
You should be fitted for, depending on what altitude you're at, because but I like where Alexa's going with this in terms of something that's adjustable, because that way you don't have to have such a huge wardrobe. But if you're used to wearing elastic compression, then I would definitely get fitted for a different size when you're at a different altitude. A lot of people that have lymphedema have all sorts of different sizes depending upon.
Love that adjustable compression. It does come in handy. Got an interesting question, and this is one actually that I would like to know too, because this is something I've experienced as well. But Edwina asked, has anyone experienced hair loss, non-cancer patients, that is caused by lymphedema? If so, how do you wear your hair when going out that camouflages balding spots? I've been experiencing and dealing with hair loss for a while now, and I feel you. It's very difficult, and talk about mental health struggles that can really contribute. But there are some ways you can, like style your hair to camouflage. There's also some fiber powder you can use to cover some of the balding spots. And also there's medications if you talk to your doctor, like minoxidil or Rogaine topical treatments. But Catherine, did you have anything to add, or you had something else?
So no, I do have something to add. So this is going to sound strange, and I actually brought this up to my doctor the other day, and he didn't answer me yet, so I'm waiting to hear back what his response is. I actually had hair loss on my lymphatic limb itself, where it doesn't grow back, and it hasn't I couldn't even tell you how long, probably since like 2001. But since I had my lymphatic surgeries, all of a sudden I now have to shave my leg, and it hasn't been in 20 years. So it's kind of strange for me. But it's really weird, because the part of my leg that was having the problem with the hair growth was the most complicated part of my lymphatic limb.
That is interesting. Is there a connection, our therapist, with hair loss and lymphedema, or how does that affect whether it's on your affected limbs or on your head? Is there connections there?
There's definitely a circulatory aspect. And one of the signs actually of arterial insufficiency is hair loss on the front of the lower leg. But I wouldn't consider, oh, I see Catherine, there's a light bulb going off.
There is, because I have venous insufficiency on that leg, and that you just made a light bulb go off on me.
But it's not venous insufficiency, it's arterial insufficiency. So it could be that, you know, I mean, there can be all sorts of other factors, hormonal factors and stress factors and environmental factors. So my experience is that lymphedema in and of itself isn't usually, but I could see where if there's a congestion in an area, that could certainly affect the circulation.
Well, even like you just said too, the stress and stuff, it's almost a cycle that's created where if you're stressed about your lymphedema perhaps or something, and then that could be affecting your hair loss, then you're stressed about the hair loss, and then it goes on and on. Veronica said in the chat, she wears a wig, which she loves. She considers it a gift for having breast cancer and chemo and radiation. It's a lovely way to frame it. And Melissa says that she has a lot of hair loss on her legs also. So I guess this is a pretty common thing.
But I would say when I have patients that are swollen, we do have just notice hair loss all the time. And then typically when we help decongest them, their hair starts growing back and they're really angry at me. So that's unfortunate, but it's good. It means you're healthier. You're getting more blood supply there.
That's so funny. You did this, Nazreen. Got hairy legs. Oh. We got a question in the chat that I think Catherine wanted to address. So Debbie asked, I have a question about hip replacement surgery for a lymphedema patient, and what do I do for the swelling after the surgery? Catherine.
So you're in luck. I am a patient who actually had a hip replacement done on my lymphatic side. My hip is actually about 10 years old now. And what we did was I actually communicated with the surgeon before he did the surgery in regards to, hey, I have lymphedema. What are we going to do to manage this swelling? Because obviously I can't put, you're not allowed to bend depending on the hip protocols that they give you for a certain period of time. So I couldn't bend past 90 degrees. So clearly there was no compression garments going on that leg. So we came up with a couple different things, but one of the things that I did do was I had them call in a lymphedema therapist into the operating room after he was done and compression wrap my leg for the first 24 hours, so that this way it tried to at least maintain my swelling level, if not try to, prevent it from getting any larger. But after that, we used Velcro wraps because somebody could help me to put the Velcro wraps on. And they're easily adjustable so that this way, if they're too tight, you can have somebody loosen it up a little bit. If it's not tight enough, you can tighten them up a little bit more. But until you get the clearance on how you're allowed to move, my suggestion would be definitely Velcro adjustable, so that this way you can have the help. Because let me tell you, I didn't do that initially the first time. And yeah, my mom was trying to help me put my flat neck class 4 compression garment on. I think I got punched in the face about 5 times because it doesn't work. So I don't recommend that.
Any of the therapists have anything to add?
I also recommend adjustable or bandaging. So a lot of my patients know how to bandage, and I'll have their families help them. I do like that that fast and go bandage. I know we talked about that in the past, but that one is lighter. And I always make sure that your surgeon is okay with it too. Sometimes they have specific pressure dressings they want to the hip incision right after surgery, and I always like to check with the surgeon beforehand, but I've never had a surgeon who's actually cared. I always like to check with them, but they always are like, oh, whatever your therapist wants to do, because most of them, would defer to us.
Thank you. Yeah, Melissa says in the chat that she loves her Pharaoh wraps, the Velcro wraps. They are awesome, she says. I'm going to switch gears and talk about shoes. We got an anonymous attendee in the Q&A box who asked if anyone could recommend any good shoes. They've been looking at the Pandair shoes online. Pandair shoes are great. The founder is a woman with lymphedema, so she knows the struggle. and she designed these shoes specifically with swollen feet in mind. So that's always good. I personally love anything that is either adjustable or is containing to help keep My rising bread dough is what I call my little buffalo hump on my foot. I keep that contained and well managed along with my compression. But anybody on the panel or in the chat too want to throw in some suggestions for this anonymous attendee on what you look for your Cinderella, lymphedema Cinderella, perfect slipper. What is that? What do you kind of look for?
Honestly, that's a hard question, but I
Yeah.
try to avoid shoes that have straps
Mhm.
because the straps will cause swelling above and below.
Yeah.
So I try to avoid those. I try to also make sure I can get ones that are stretchy so that this way, if my foot needs it to stretch out, it can without causing, but you also don't want it too low in the front because if it's too low, it's going to cause a bump on the top. So needless to say, a lot of times I wear sneakers.
Well, it's like trial and error you were talking about earlier
Yeah.
on tonight. It's trial and error condition. Well, also, I think Zappos.com, I think you can order 2 different size
Okay.
shoes too.
You
So
can.
that's worth looking into if you want to kind of try some out. And if you wear 2 different sizes, as a kid, I used to go to Nordstrom and they did 2 different sizes back then too. I don't know if I'm sure they still do that, but that's another option. But yeah, shoes, the eternal struggle for us lower extremity people. All right. We've got oh, Lori says in the chat, legs like mine, new shoes being developed by and for lipedema and lymphedema. We'll have to keep an eye out on that. That's pretty exciting. That's the best when it's people in the community finding solutions to this problem because they know best what works for our unique feet. Okay, so we're going to move on to some more Q&A. Kim in the Q&A box asked, how do you use physical therapy to aid with lymphedema? I found out that the stretch zone therapy is better for me than the lymphedema therapist, but I can't bill to my insurance. I'm not familiar with stretch zone therapy, but maybe someone on the panel. Go ahead, Catherine.
So I believe Stretch Zone basically does a lot of manual stretching on, because I've heard of it, I've seen advertisements for it. I can say that for me, when I use a lymphedema therapist, my lymphedema therapist is a physical therapist, and not only does she do the lymphatic drainage with me, but and compression around me, but we also do some exercises which helps to move that lymph while in the compression, and to keep the strength up in that leg for me.
Thank you.
I'm not 100% sure of stretch zone, but I'm imagining if it's something that's working on flexibility, right, in the body and possibly getting the tissue moving. I mean, that skin stretch and that mobility is really going to help with lymph drainage. So I feel like with everybody, their treatment is so different. So if you find something that works for you, none of us are going to tell you not to do it, and we may tell our people to do it because it might be something we haven't thought of. We are all learning here together, so.
That is so true. Every day. Oh, Kim had a question in the chat too. She asked, does anyone have any problems with lymphedema affecting your neck and head? I have a lot of popping and cracking. My doctor's not worried unless it's causing me pain, which it's not, but it is a weird feeling. Anybody?
I'd like to know if it's because the swelling in the head and neck is because of a head and neck issue, or if you have lymphedema somewhere else and are also having swelling in the head and neck. So I want to ask the person that wrote that question to do a follow-up so that we can address that more accurately.
Well, while we wait for that, we did get a question in the Q&A box from Francie. How widely used is 3D imaging for measurements for compression garments? I participated in a study and it's so quick, easy, and accurate. We have such a hard time finding therapists that do measuring. I've seen that. I've seen Medi doing that with the cool. It's pretty neat. I haven't done it personally, but what'd you say, Gab?
It's called MediVision.
Mm.
I actually had garments made with that and it came in really awesome. But it's as far as I know, it's the only company that does it. So if you're not wearing a Medi garment, you're not going to get it because every company's measurements are slightly different.
And I feel like even with when you're getting fitted too, there's so much variation, even if depending on who's taking your measurements. I've had so many garments redone. I know this is a tale as old as time for a lot of us. We have to get garments sent back and remeasured and all that. And so, yeah, that's a really cool development though, the MediVision.
I don't think that a lot of clinics are using 3D technology just because it is expensive. And so it's another piece of equipment to buy. But there are definitely places and fitters who use it. So if you like that, hopefully there's more and more, because I mean, it is a great thing.
Future.
I personally have used it and seen it before, just at conferences and things along that line. I don't know a single therapist who actually uses one, in my personal experience, because nobody can really afford to use it, unfortunately, because it's not just the device, but also there's security depending on your organization you work for. And that's more so, I think, what the concern is. But it is really cool. It's very accurate. So if you know somebody who can do it, by all means, I would say it's a great route to go.
Awesome. Yeah, it's neat to see, developments happening. It's exciting stuff. We're winding down, and we did have a topic that we wanted to get to, that Catherine brought up in our pre-show chat about lymphedema and its effects on skin quality, inspired by her recent skin graft. And she wanted to also talk about how her lymphedema and skin dryness impacted its ability to heal. So, Catherine, would you like to talk a little on that topic?
Sure.
Yeah.
So I know some of you noticed that I was here last month, but I kind of disappeared. That particular day, I actually found out that my skin graft may have failed. So it was a little bit sad day for me. However, I was able to save it. We did a little experiment in terms of putting the moisturizer that we were using to keep the skin graft moist on my leg, and realized that my leg was sucking up the moisture, and it was no longer being able to be kept moist, because and I realized my lymphedema leg is always very, very dry. And so that actually impacted the way I needed to take care of the skin graft in order to keep it moist. So initially we were doing it, they just wanted me to put quite a bit of moisturizer on it once a day for every 24 hours. Well, that didn't work. So we kind of experimented, and we tried twice a day. And this is after we thought we failed it. And that was working a little bit better, but it was still on the dry end. So then I did 3 times. So I then wound up doing it like every 8 hours, and I was able to save my skin graft to the point that it is 100% healed, and we did not think it was going to be. So I got the official word from the doctor last Tuesday that he was very, very pleased with the skin graft and was not expecting it to do what it did. So just as a note, like when you have lymphedema, sometimes as we go back to my trial and error, you have to kind of see what works and what doesn't work. So even though we thought we lost it, we wound up not losing it. And luckily, because why did I go through a surgery for me to lose something so quickly? And a skin graft is very fragile, so it can be lost pretty quickly. And lymphedema can affect that, because they have to keep it underneath. It's got to be dry. Can't have fluid collections underneath of it, but on the top it's got to be moist. So it's kind of a catch-22 to really make sure that it's going to work. And we weren't 100% sure it was going to work, but luckily it did.
That's awesome. I'm so glad to hear too that it worked. I mean, superhero Catherine, you always pull through. You always pull through. I knew you could do it. It's amazing. Yeah, do we have anyone want to say anything, and just in general too, because skin care is so important with lymphedema in general, keeping yourself nice and moisturized, using your Eucerin or whatever, nice.
Cocoa butter is a good one too.
The what?
Cocoa butter.
Yep, cocoa butter. I think we had a conversation probably last year about Crisco. I think, Angela, did you say it? I remember. Yeah. I mean,
but Steve Fenton knows about the doctor who told me about Crisco.
Yeah.
Oh, yes.
That's awesome. Yeah. So keeping the integrity of our skin, nice and intact and moisturized is super important.
It's
with-
really easy to go with the Bath and Body lotions that they claim to be moisturizing. And I've found that they're more smell goodies than moisturizing.
Smell goodies.
Well, see,
You
and
start
I
calling
have
them
the
that.
problem of I have a petroleum allergy. So needless to say, finding a moisturizer that works is not necessarily easy because I can't have any white petroleum in them at all. Most lotions have that. So we had to get real creative because a lot of times when they do a skin graft, they like you to use Vaseline. Well, Vaseline is petroleum. And that was not going to work for me. So we had to really think outside the box. And oh wait, I think outside the box every day with my lymphedema at this point. So
That's awesome.
yeah.
Nazarene, before you joined, we were talking about mental health and lymphedema. Do you have any insights to share from a therapist perspective too on how some coping strategies or how patients can kind of treat their mental and emotional well-being as well as their physical?
I have so much. I always talk about this with everyone because this is a condition you're going to have to manage. I'm sure there's periods where it's better and then it's worse, but it's something you will have to manage. I think taking care of yourself mentally and sometimes giving yourself allowances, find out kind of what is most important as far as for managing, and let yourself have a little bit of freedom here and there, because or else it can be very defeating if you feel like you can't do anything and you can't live life because all you're doing is managing your lymphedema. And I think sometimes too, when family members try to encourage people, sometimes it makes you feel bad, like, oh, you should just be doing A, B, and C. And I feel like sometimes even in our community, that can be hard because myself as a therapist, I'll be like, hey, do these 10 things every single day for 20 hours. Yay, right? And you'll never sleep or do anything or see friends. So I always have to make a point to tell everyone to like take some time for yourself, do things you like. You're not going to manage all of this to not live. So I want everyone to find something they like to do, make sure they make a point of that. And then I like to make tasks for people. Maybe, you wanted to do, a couple things to manage your lymphedema each and every day, which I would love you to do many things every day, but to try to make them a little bit more manageable. So like have yourself some easier tasks that could be helpful for managing your swelling. And it could just be something that at least will make you happy that you did it. And it could just be deep breathing, right? And it could be while you're watching television. It could be something, and then you know that you've done that. Or if you want to watch television and you get yourself something like a pump, which would be great, or a vibration plate or something that you could be a little bit more passive and you could do something that you like to do, or even just something like pumping your ankles would be great. But I want people to remember all their efforts are really, helpful and that you are making progress and everything. Don't feel defeated because I know that can be really hard for people. They'll feel like, am I doing all of this for naught? But I do think that taking a little time for yourself every day, or even just taking a couple days off, is really good. And I do, after I saw Alexa maybe a month or two ago, but I think the other thing too, and this is good, is, I know sometimes it can be defeating knowing that you have to advocate for yourself because that can be something, her and I talked about, that you really need to just be the person, because you're not always going to have somebody who knows about you or what you're doing, but to not get frustrated and come back to a group like this, because I feel like every single person on in this group has kind of been in your situation. So you have a whole community that can help you too, who's been there, who has had to fight for themselves, for whether it's proper therapy, proper treatment, surgeries, whatever the case may be. You have a whole group here of people who've been there and can kind of help guide you through this. And I feel like that would really help, with your mental health, to know you're not alone, that you have a whole community to help you. But honestly, taking time for yourself is key and necessary.
That is super important and a wonderful reminder for all of us. And Sandy had said in the chat too, with regard to mental health, there's a meadowlark singing right outside my window. It is a glorious song and it lifts my heart. So that's one of those, we were talking earlier about finding those little things and that make you happy and bring you joy. And that's just so lovely. And we love all of this. Was a great discussion tonight. And Nazarene did bring up breathing, which is so pertinent because if you all were here last month or watched the replay, you remembered that Karen led us through this wonderful manual lymphatic drainage exercise. But tonight, she said she'll lead us in a diaphragmatic breathing exercise. So this is going to be a really nice way to kind of wind down from the evening. And it's a good tool to have for a little self-care thing you can do too. So Karen, I'm going to pass it over to you to get us breathing.
Great, good. Well, I thought that diaphragmatic breathing would be a really good thing for Mental Health Month, as well as lymphedema, because deep breathing has so many physical and mental, emotional benefits. Among them, well, first off, we talked last time about how the lymphatic system does not have a central pump like the heart, but the diaphragm comes pretty close because we have actually seen the lymph flow increase using ICG imaging when people start deep breathing, which is just amazing. And so lots and lots of effects on the lymph system that have been proven many times over. And then in addition to that, there's a whole relaxation response that happens with deep breathing that lowers blood pressure. It lowers heart rate. It reduces the levels of stress hormones in the blood, and it reduces lactic acid buildup in the muscle tissue. So if you've been working out, finishing your cool down with some deep breathing can really help that. It helps to balance the levels of oxygen and carbon dioxide in the blood, and definitely improves the immune system, increases our physical energy, increases our feelings of calm and well-being, and everything that I can think of positive, deep breathing really has there. So some of my patients, when they come to me, and by the way, I teach this at the very first visit of every patient because I want to start off with that. And then we practice deep breathing at every session so that we can, remember and link into it. Some people have trouble with that. A lot of people carry stress in their shoulders. And many people, when they breathe, they're actually using the accessory breathing muscles that go up the neck. And so their shoulders are actually going up and down. And the accessory breathing muscles are meant to be used when we're really huffing and puffing so that we can call in extra help. But for the diaphragm, we want to use the muscles in our belly. And sometimes patients have a hard time identifying which muscles should I use because they're so used to using these accessory muscles. So for all of you, if you want to, if you can, I recommend that you lie down, if you have a bed nearby, or even the floor or a couch, or even if you can recline back a little in your chair. It might make it a little easier to get to the tummy because sometimes when we're sitting and we're upright and we're kind of activating all these postural muscles, it's harder to relax. It's harder to get to the diaphragm. So that's number one. Number two is put one of your hands right on your belly button and then put another hand on your heart. Now, what we're going to do is the opposite of deep breathing. I'm going to ask you to breathe out all of the air in your lungs. So go ahead and blow it out. And notice that when you take the next breath, it's deeper because you've gotten rid of so much of that air that's in there. So try that again at your own pace. Go ahead and just do a big, huge exhale and exhale every single bit of air that you possibly can. and then breathe in again. And it feels so good to breathe in after you've had a big exhale. Breathing can be very pleasurable. So now let's look at your hands or feel your hands and just take some normal breaths and notice if the hand on your belly button is moving at all. Because when we breathe using our diaphragm, it actually pushes our hand up and down. So as you breathe in, you should be pushing out and your hand should be pushed away from your body. And as you exhale, then your belly collapses and the diaphragm shifts so that your hand moves in towards your body. So just play with that a little bit and kind of get curious. And if you want to get really tricky, you can start by breathing everything out. And then with your next breath, feel your tummy rise and then let it continue into your chest so that your tummy fills up and then your chest fills up, and then let it all out. So there are some great teachers who teach different ways of breathing. Kathleen Lisson is one who comes to mind, and she's done some really wonderful webinars for LymphaPress. If you Google Kathleen Lisson and LymphaPress, you'll find her. And she has all kinds of resources for stress reduction. I mean, talk about mental health. That woman is a treasure. But she also has a lot of ideas of ways that you can count while you breathe. And I'm going to teach you one of them. And this is called square breathing, which I learned from Andrew Weil. And so basically, it's breathing in for a count of 4, and then holding your breath for a count of 4, breathing out for a count of 4, and holding your breath for a count of 4. And when I say hold your breath, it just means that you're neither breathing in or out, you're just relaxed. So try that at your own pace as you breathe in, 2, 3, 4, and hold, 2, 3, 4, and out, 2, 3, 4, and hold, 2, 3, 4. And you may want to do it a little faster or a little slower than the way that I'm counting. But that's something that I personally use. If I wake up in the middle of the night and I'm having trouble getting back to sleep, I use my breathing techniques because that is very effective for me just to relax a little. So these are just a few little tips for helping your lymphedema, helping your stress, helping your general mental and physical health. And I think that the more that you can remember to focus on breathing, the better your life will be.
That was so relaxing. Thank you, Karen. David in the chat said, Karen, this is great. Thank you for walking us through these breathing exercises. If you recorded a guided meditation, I would pay for it. I think we all would love that. Could listen to you forever, Karen. I'll make sure too to include in the replay email when that goes out links to Kathleen's webinars that she's done on guided meditation and breathing exercises, because it's so helpful, especially with stress and mental health, as well as helping to move our lymph. So we so appreciate that. And speaking of webinars, we've got one this week. Well, tomorrow night's the Lymphedema Patient Roundtable, and then the night after that is a webinar on central lymphatic surgery that Catherine is can speak a little bit to. We're running out of time, but if you want to say like a sentence or two on why people should attend that, and I'll put the link in the chat too.
This is actually being done by the only surgeon in the United States that repairs your central lymphatic system. It's actually a doctor who did mine 2 years ago. He is going to share what he does. That's what he told me on last Tuesday when I saw him. That's what he's going to share, but that's about as much as I know. So it will be, there's always lots of questions on this roundtable about the central lymphatics. So with that being the case, this could potentially answer a lot of your questions, and you'll have the ability to post your questions to him and he will be able to answer them, hopefully.
Awesome. Thanks, Catherine. Yeah, it's going to be really interesting. And if you can't make it live, we'll have the replay up on the Lymphopress USA channel on YouTube.
No, this is not Dr. Chen. This is actually Dr. Kovac from University of Pennsylvania.
That's right. All right. So we are at 9 o'clock Eastern Standard Time, which means it's closing time for the roundtable. But we so appreciate everyone being here tonight, whether it's your first time or your 31st time. We love spending this hour with you every month. And we're here on every second Tuesday of every month at 8 p.m. Eastern Standard Time. I dropped the link in the chat to register if you haven't yet for next month, but you'll get the replay with the link to register for next month too, once that's up on YouTube. And if you can't make it live, like we said, we hope you'll still register so you'll automatically get that email. We also put this on our podcast, Lymphopress Podcast, if you search it on Spotify or wherever you listen, so you can listen to us while you're in your pump, if you'd like, or on a walk moving your lymph. We can be wherever you need us to be. But anyway, we are so glad that you joined us tonight. We love talking with all of you and connecting, and we'll do it again in June. I think June 11th is the second Tuesday, I believe. So we'll see you then. Much love to all of you. Thank you and have a great night. Bye, everyone.
Bye.